Good afternoon, everyone. Happy Thursday. This is Dr. Mesheca. Welcome to Inspiring Moments. Come on in to join me. I know it's 2 o'clock. Most of you are probably getting ready to get off work. I start late, so this is my lunchtime, fortunately and unfortunately. So it's a little late in the day, I understand. But I do thank you all for joining me. Today's topic will be the truth about wearing false lashes. So I know I have some people out there that wear them, and if you don't wear them, of course you may have family members or friends that wear them. So hopefully you'll get some information today. If you are watching, feel free to wave, comment in the comments, or if you even have any questions. So let me start off by saying, oh, hi, Dr. Lamont. Hi, Sharon. Thank you for watching. Welcome, welcome. So I just want to start off by saying I am Dr. Mesheca. I am an award-winning optometrist and beauty boss. I am an eye doctor as well as a former chemistry major who has blended my interest of eye care as well as chemistry to bring you information about eye care as well as products that we use in and around our eyes, so that I can help you all to be safe and be beautiful without, sacrificing the health of your eyes. So again, welcome. Come on in. Just waiting for a couple more people to join. Again, it's Thursday. The week is almost over. For me, today is my last day of the week, so I am shouting to the hills. We have a very long weekend, fun weekend for my family and myself, so I just cannot wait for this day to end. If you know someone who may be interested in the information, feel free to share this video, and I'm going to make sure that I upload it for my other beauty bosses out there on YouTube, since a lot of you watch YouTube and Instagram. I'm going to try to share it there as well. So again, let's go ahead and get started. I don't want to keep you too long. Well, again, today we're going to talk about the truth about wearing false lashes. So last week after I did my last video, and I thank you all for joining me last week and sending me messages and questions and commenting on the video. Thank you so much for joining me last week. But after I did my video last week, I actually went into one of the salons here in the area, local salons at one of the retail strip malls that's close by. And I was, looking to get a mani and pedi just to relax a little bit. It was late in the evening, happened to be after work. So as I was waiting, because the salon was very busy, I noticed that there was a young lady who came in. Her makeup was flawless. She looked flawless, outfit nice, great boots. And she sat down and she told one of the salon associates that she was there to get her brows done and her lashes done. So, I was just a little intrigued. Full disclosure, I have never gotten my brows arched, 1. And 2, I've only had lashes once in my life, and that was 15 years ago when I got married. So, this was just, since I was waiting, I was just sitting there watching what all happened with this process. So in any event, the salon associate proceeded to do the young lady's brows first. And then she went to, I guess, pull out, she pulled out some lashes. She had this booklet. And so she asked the young lady what length she wanted her lashes to be. So, I'm like, wow, you get to choose the length, so I was so excited. So again, I'm watching this process again. So the lady, I guess, chose. And so the woman proceeded to have the client sort of lean down, because she was a tall young woman. So she had her lean down and tilt her head back to, put this product on. So the first thing she grabbed was this little teeny tube. And the little tube to me looked like crazy glue, but I'm sure that, hopefully that wasn't what she was putting on her eyes. But she pulled out this little tube, and of course she had the lashes as well. So she the young lady tilted her head back, and so the associate proceeded to put this substance, this sticky, it looked sticky to me because I was pretty close there. But she put this substance along the eyelid, the top eyelid margin, and she took out the lashes, which looked like they were on a strip, and she placed them on the lady's lid, and she kind of patted it down with this with this type of apparatus. And then she did the other one, and that was it. That was done within a matter of minutes, probably less than 5 minutes. And again, the lady looked out looking just as flawless as she did when she came in. So I thought about something. I was like, wait a minute. The woman came in with a full face of makeup, and this associate did not, for one, I noticed she didn't put on any gloves. So I was a little grossed out by that. And two, she did not even wipe the region where she was putting the sticky substance, the glue or adhesive, and the lashes. So I was just surprised. And I think I was so grossed out that I just decided, if this is how they, if this is how they practice their sanitary practices, I don't think I want to get my mani and pedi done here. So I proceeded to leave. So as I was in the car, I just thought about, like what there has to be some kind of way that I can bring this message to you, my viewers, that, there are effects of wearing these false lashes. So I told you before, I don't wear lashes. I haven't worn them in about 15 years. So I went to the beauty supply store just to kind of look around. And I was amazed at how many brands of lashes there were just in this little beauty supply store that I went into. So I just, I wanted to touch and feel and see, what they were. So I bought some here. As you can see, they're very teeny. They appear to be pretty soft. But this thing came with a whole kit. So it had that. This is the apparatus, because I was interested in knowing what was the lady doing with. So I guess this is the part that she was using to sort of make sure that the lashes fit properly. And then this was the little tube. Now, the tube didn't look exactly like this. It actually looked like the green and white crazy glue tube. It didn't look like this, but this is called lash eye adhesive. So basically, I wanted to talk to you all about at least one. There are several common problems that can occur with wearing false lashes. And let me just take a minute to say hello to people watching. Hi, Vicky. Thank you for watching. Okay. Hi, Sharon. Sharon has given me a comment. Thank you. That the eyelash adhesive is not that far off from crazy glue. Oh, my goodness. Okay. And hi, Cousin Robert. Hi, Dr. Carol. Thank you for watching. Okay. So again, I want to get back to some of the common problems, or at least one common problem that can occur with wearing false lashes. So the first thing, the first thing that I thought about that could happen is a condition called contact eyelid dermatitis. And basically, this is a condition that is more or less like an inflammation of the eyelid. And this can come from the actual adhesive product, and it could also come from the lashes. It's just basically when anything is touching the skin of the eyelid, and you can get dermatitis any part of your body, you can have a reaction to that. So keep in mind that these lashes are made from synthetic fibers. They are not like the hair of our own lashes, but they're made from synthetic fibers. They're made from plastic. They're made from real mink animal fur. And sometimes the lashes are a combination of all of these, of all of these things, of the synthetic things, I must say. And the cost depends on, how close you're getting to real mink. So just a couple of things to go over since we're talking about eyelid dermatitis. And because both of these things can cause it, I wanted to basically let you know. So I have the eyelash adhesive here. I'm not going to show you the brand because this is the brand that I bought, and there were tons of brands. But most of them, as I was reading, they have the same thing, same substances in them. So the eyelash adhesive. Listen to the products that are in these. You have water. Okay, that's good. You have cellulose gum, sodium sulfate, ammonium hydroxide, fragrance, coumarin, geraniol, limonene, and these last two, rubber latex, as well as formaldehyde. And we are putting that on our lid margins as close as they are to our eyes. This is what we're putting. This is what's in these products. Okay, so because the contact eyelid dermatitis is an inflammation of the lids, again, you can think of this as an allergic reaction that can happen to the eyelids. Some signs and symptoms would be itching that occur immediately when someone or yourself, you're putting the adhesive on, or after the adhesive if you put the lashes on. You can get itching, you can get redness, you can have swelling of the eyelids, you can have little bumps that can occur around the eyelids. But the treatment, since we're talking about the signs and symptoms, the treatment would basically be to try to remove the lashes, possible over-the-counter antihistamines like Benadryl. But my best recommendation would be to see your eye care provider. Give them a call. Let them know what happened, what type of reaction you're having, and, just to basically seek medical attention. So one of the products, and I'm not going to bore you too long with talking about all the products. Again, I was a chemistry major, so I love chemistry, and I look at products of everything, my foods and things that I put on my body. I'm just a product person. So one of the products I went to look up was formaldehyde. Formaldehyde is something that I've always heard about in reference to it's a liquid that they use to help preserve bodies. That's probably the major time that I've heard about formaldehyde. But formaldehyde is a common substance that's in cosmetics. It's in shampoos. Formaldehyde, they're in household products. So it's basically everywhere. Well, the American Cancer Society actually listed it on their website as a common cause of cancer that has been found when tested in lab animals. Okay, so I know that's a whole lot of information for you, but the take-home message is, first of all, if you're going to apply these products, or if you're going to go to a place that applies the products, these lashes, to your eyes, because we only have 2 of them, we need to take care of them. Make sure that they are using good sanitary practices. If they don't have gloves on, ask them, hey, are you going to put some gloves on? Make sure that they wipe the surface of your eyelids before they are putting these products on. We definitely wouldn't want any type of what you already have on your lid or lashes to have an effect with what they're putting on, the adhesive or the lashes themselves. And I would also recommend that if you do have a bad reaction, that you do seek medical attention. Again, if you have any, I would love for you to comment, or if you have any questions, things of that nature, to please write them in the comments there. Share this message with anyone that you think could use it. Some people that use lashes. And I guess since I've been doing my research and I have all of my stuff over here, now I'm not going to apply it myself, but maybe I will visit one of these salons and have them put lashes on me, and I can come back and tell you all about the experience that I actually had getting lashes for the second time in my life. So I hope to, again, I want you to share this message, and I'm going to see you next week, and we'll talk about another effect of wearing false lashes. And, I will bring you more information in the future about eye care, as well as how these different products are, the products that we use in and around our eyes can affect us. Just to let you know again, hi, Sora Jennifer, thank you for watching. Hopefully you all have gotten some useful information. Again, share, comment. If you have any questions, you can leave them in the comment section, or just direct message me on Facebook. So again, to end, my name is Dr. Mesheca. I am your award-winning optometrist and beauty boss, and I hope to bring you tips that can benefit you in learning more about the products that we use in and around our eyes, merging my two interests of eye care as well as chemistry. So thank you all so much for joining, and have a wonderful, wonderful weekend.